I can't tell you how extremely important it is for you to have good resources during your clinical rotations. I'm going to share with you 3 apps that I use that have helped me become more knowledgeable, more successful, and help me understand the big picture during my clinical rotations. If you're new here, my name is Safiya. I'm a registered nurse and nurse practitioner student in my 2nd year of NP school. So I don't really bring books to my clinical rotations. I just use apps. 2 of the apps that I'm going to tell you about have websites, which is really convenient. I just feel like apps are super resourceful because you can search whatever term that you want more information on and it'll populate like automatically versus trying to search through a book to find your answer. I bring my iPad in to my exam rooms when I see my patients. So I'll have one of these websites up in case a patient asks a question. Having a resource that you can go to automatically is super helpful because if a patient asks a question and you don't know, you can just let them know like, oh, that was a great question. Let me find out for you. And you have it right up on your laptop or your iPad and you can give them that information right then and there. But of course, use whatever resource that you like during your rotations that help you learn the best, whether it's an app, website, or a book. Okay. My number 1 resource app that I use is called Hippocrates. I could recommend any app to a nurse practitioner student. It would definitely be this one. It's literally like a one-stop shop for all of your medical questions. So I just wanted to show you guys how the Hippocrates website looks. I'm gonna search diabetes. It gives you really quick highlights on the condition that you're searching for, along with signs and symptoms, diagnostic tests to run, and treatment options. It also gives a really clear definition on what diabetes is, the prevalence rates, along with the pathophysiology. There are also subsections within the topic that offer a lot of different information regarding the condition, like what criteria is used for diagnoses, lab abnormalities, and their rationale, non-pharmacological and pharmacological treatment options, and a step-by-step treatment approach. There are probably thousands of medications on this website, but I like that it's alphabetized and also organized by its specialty. I'm going to search for metformin, and it'll show you the recommended dosage forms, what that medication is used for, any contraindications, side effects to look out for, and it also has a drug-to-drug interaction tool. You know how when you're doing a med rec for a patient and they're just like, oh, I don't know, I take that little pink round pill, it's like super tiny, but you're just like, yeah, pink, oh, okay. And you have no idea what they're talking about. Well, Hippocrates has a resource where you can type in the descriptors of whatever they're saying, of the pill that they're taking, and it'll show you all of the medications that look like that pill. Of course, this isn't how you verify the accuracy on if they take this medication or not, but I thought it was like a really cool resource to have. Lastly, the cost. So the cost for this app, it's free, but it is limited to how much free information is available. They do have full access to the app, but it's $175 a year, which I'm not paying. So here is a hack. You can get a 1-year free subscription to this app if you email hippocrates.com So if you email Hippocrates.com, they'll give you a full free access to their app for 1 year. You just have to email them from your student email and let them know that you're an NP student or MD or PA student, and they'll give you access. You have to remember though to cancel before that 1 year, or else you'll be charged, of course. Say hi, girl. No. So if you don't want to risk being charged almost $200 for an app, I feel you. The next app that I use that's completely free, it's called Medscape. Even though Medscape is a website that the entire public can have access to, it is an accredited website. Everything on this website is backed by evidence-based research, and all the information comes from the top physicians and pharmacists in the world. So it's a very valid website for you to use for any clinical questions that you have. Medscape has the same features as Hippocrates. The only thing I don't like is there's a million ads on their website, especially their app form. So it makes it kind of difficult to search through it. But otherwise, it has everything that you need. My last app that I use, it's called Labgear. I really love this app. It's only used specifically for lab abnormalities. It's only available as an app as well, unfortunately. It's not in a website form, but it's still a really great resource when explaining lab results to your patients. I feel like we order labs more often than not, and a lot of the patients that I see during my clinical rotations are coming up for a lab result. So this app is really useful for that. I feel like labs can be kind of daunting because there's so much that can be interpreted from it. Although as nurses, like of course we know these labs and why you test for them, the highs and lows, clinical manifestations of that, but it's really great to validate your knowledge through this app. It's a one-time fee of $30, which isn't bad because you don't have to have like a monthly membership or an annual membership. So I definitely feel like it's worth the $30 because it's something that you would use very frequently. If you like carrying books to clinicals, I definitely recommend the Family Practice Clinical Guidelines book. It's a really great resource that has like actual clinical practice guidelines, which is what we should be adhering to. My preceptor has it in her office, so whenever I have questions on how I'm gonna treat a certain condition, I go to this book, and it gives me a really clear layout on clinical manifestations, treatment recommendations, medications that are often prescribed, along with the dosage and the frequency. So those are the 3 apps that I use as my resources during my clinical rotations. If you're an NP student and you have other resources, definitely let me know. I feel like we can use all the help that we can get. I hope that this has been helpful. If it has, please give me a comment. Please like and subscribe, and I'll see you guys in my next one. Bye. Bye.